The next panel is going to be on Northern Colorado champions. So this one is going to be moderated by Commissioner Terry Hoffmeister. And I know if you're looking at your agenda and you're saying, where is our networking break? You all were such chatty Cathys that we are going to roll right into the next one. That's what we want you to be. So we're going to roll to Northern Colorado champions. We'll bring up Commissioner Terry Hoffmeister, Alayla Kay, Dr. Dawn Stater, and Dr. Leslie Brooks. With this, there's a reason we chose to come to Northern Colorado. And it really was due to the leadership that we saw here from our excellent speakers here today, as well as many of you in the room. Do we see anyone from Northern Colorado want to stand up or raise your hands again? You all are champions, and that's what we wanted to highlight. And so I'm honored to pass the mic over now to Commissioner Hoffmeister. One of the first things I'll just say, one of the most touching moments of last year's conference for me was when he talked about some of his reflections on the conference. So thank you.
Thank you. Okay, since we're the only thing between you and lunch, we're going to take all the time we need. First off, as was mentioned, I'm Phillips County Commissioner. I have so enjoyed the flexibility that I've been given to operate and participate in so many different things that I never dreamed I would ever be in. It's just amazing. And as was mentioned, why is everybody here? Because we care. With that, I have Alayla Kay to my right with Omni Institute. Dr. Dawn Stater, Naloxone Project. I'm not sure if I even need to introduce Dr. Brooks. She is so well known. We are so honored. At this point, I'm going to turn it over. Each one is going to talk about their role and why they are Northern Colorado champions.
Thank you. So I did put some slides together because I do like a visual, so I don't know if that's something that got queued up already or not. Christian, I'm walking you back, and is that a thumbs up? It's happening? Maybe. Anyway, my name is Alayla Kay. Oh, here it is. And I am a director at Omni Institute, but more importantly for this context, I am one of the lead Region 4 facilitators and providers of their backbone support. So we provide their evaluation, data, facilitation, coordination, all the things. And really the reason I think I'm up here is just to brag on how awesome I think the Region 4 Opioid Council is, because I really do think that. Just to give kind of overall context, up behind me, you see kind of what our board member looks like. So we have 11 voting members. Again, we are the Northeast region, so it is 10 counties. And in those 11 members, 7 of those are county commissioners, 2 are from municipalities, 2 are from law enforcement. Then we also have an advisory board, which is made up largely of our public health department folks in the area, and our substance use treatment, prevention, and recovery providers in the area who we really rely on. And some of our key focus areas that the board and the advisory folks were keen on from the beginning is really thinking about what are all the regional needs. So this region is very focused on making sure that not one county gets left behind within this large 10-county region. So making sure that we're looking at the data, that we're seeking out folks with lived experience, getting surveys out there, getting key informant interviews out there, getting and listening to what's happening to meet the needs. Focus on sustainability. Our commissioners, Scott Weaver and Terry Hoffmeister, are always talking about, seed money, that this is really here to start something. And so how can it continue and not just end after this money goes away? And yeah, I think otherwise, then that is kind of the main thing, and as well as, of course, increasing access to services. So just a highlight, I think, that has happened early on in this region is they focused on transportation, because they already knew that people struggled to get to health care services. So making sure that people could get to substance use services, substance use treatment, recovery, all of that, was a big focus right from the get-go. So increasing access overall has been like a real theme throughout. So next slide, and I'm not going to talk too much more, but we know this work is hard and we're not there yet, but we really do try and celebrate the accomplishments that have been made and try and do that as often as we can to keep everybody kind of excited and going. And so these counties know how to collaborate really well in this region, and they show up and they show that every single time that we're meeting together, that we're pushing funding out, that we're holding RFP processes. So that's been just a real pleasure to watch. This region has always utilized data, both in what is available out there as well as talking to the community, getting that feedback back into, which I think is a real strength of this area. We have already funded some great RFPs out there that are doing great work. We've been evaluating that work. We can tell that story. I have lots of information to pass out that I have here, so you can come find me. But we're really excited about all of that. We were also awarded infrastructure grants last year from the state to help support that effort. So we're just really pleased. And then we have new funding that we have just awarded to Colorado Roots and Don Stater's group. So we're also really excited about that. So my final slide, and then I'm going to stop talking. We're just going to continue to do what we have been doing so far, which we felt like has been working, which is really looking at our data, reviewing our evaluation data, making sure it's as transparent as possible, trying to engage the community in the Region 4 area as much as possible. And yes, as a part of that, one of our successes that I think has just really started to come is just more collaboration amongst the providers in the area. We're starting to and going to be continuing to meet to see how can we all apply for different grant funding, whether it's state, foundation, or federal grants moving forward to take advantage of some of the seed money and just continue to grow the services in this region. And yeah, we're just trying to get together as much as possible to talk about the region needs and to talk about how everybody in this area can support themselves. So just wanted to share all that, but yeah, this Region 4 work has been really rewarding, and I think the credit goes all to the council members and the advisory groups.
I think my team put together some slides, but you can just ignore them because I'll just go off the cuff. So first of all, I've just been so impressed by the amazing work being done by our jails and by our prisons in expanding access to patients with substance use disorders. That deserves to be so commended. And before I actually moved and worked in Hugo, Colorado, which is right a little south east of Lyman, in our critical access hospital, Lincoln Health, I actually worked at Moffat County and actually at Craig Hospital. So we may have even shared patients. But it was amazing when you said that you were providing treatment since 2015. You know, at that hospital, and every Colorado hospital I've worked at, I've been the physician who got buprenorphine actually stocked in our Pyxis so that we could treat patients. And I think I've got a new motto after today, which is I want treatment to be as easy on the outside as it is on the inside to access. Okay? So, with that, I have the great pleasure of actually being leadership in two programs. One is the naloxone project. We provide naloxone in every abatement council region to your hospitals, to your EMS systems, to your clinics. And it is our distinct pleasure to do so. And we've been doing that on the Eastern Plains since our beginning in 2022. And if you do not have naloxone, please get in touch with us. Our naloxone staff, could you raise your hands? We would love to help you sling naloxone with overdose education and a message of hope, humanity, and value and worth for any individual with substance use disorder. The other thing which I'm actually invited to speak a little here today, and I'll try to be brief, because we all know who the main show is, right? She is amazing, right? Yeah. No, it's you. Yep, you are amazing. But we also run a new program called Colorado Roots. Colorado Roots stands for the Rural Opioid and Addiction Treatment System. And really our big opportunity was around a year ago. We had an opportunity to say, hey, let's build an IOP program on the Eastern Plains. And I said, great, IOP is wonderful, but IOP has to refer above and below the 4 ASAM levels. ASAM level 1 is, outpatient treatment, 2 is IOP, 3 is withdrawal management, and 4 is hospitalization. And if you want us to build one, we're going to build all of them. Are you okay with that? And they said yes. So the question is, how do you provide all 4 ASAM levels for a rural community that might only see 3 to 4 patients with substance use disorders in a month? How can you actually fund that? And the answer, there's 2 answers. One is together. So you actually have to band services among different hospitals and different communities. And then the second is you can't build something that you expect to stand alone. And hospitals, going back to that theme of treatment should be as easy to access on the outside as it is on the inside, is hospitals need to be centers of addiction treatment in rural communities, period, end of sentence. So through Colorado Roots, we work with 7 of our hospitals, or 8 of our hospitals on the Eastern Plains, hopefully all of them soon, to actually stand up addiction treatment that is easy to access, referral to IOP, referral to peer, and we all know how important peer is, and then also top-notch addiction care when people are in the emergency department or are hospitalized, because that is what our communities need. And I will end with a statement that is one of my favorite that's shared by our CEO, Kevin Stansberry at Lincoln Health, which is where you live should not determine if you live. And that is especially true in rural communities.
Good morning. Thank you so much for being here in Northern Colorado today. My name is Leslie Brooks, and I serve as I've had a number of roles in Northern Colorado. I work for the North Colorado Health Alliance and currently serve in a physician consulting role. My day job, I serve as the Chief Medical Officer for Summit Stone Health Partners, the Community Mental Health Center serving Larimer County. But I have served in the safety net my entire career. I have some Denver Health colleagues here. Denver Health trained me and raised me many years ago prior to medical school. Judy Schley, if you're out there, hey, how you doing? And then served in the safety net in the federally qualified health center. I think we have some Sunrise partners here who gave me the space to practice and to lead and to bring addiction treatment to a primary care setting. And I could not be more proud to serve in Northern Colorado. And I think part of the question that we had posed to ourselves as panelists is, what has made Northern Colorado successful? If we've experienced any success, what are the ingredients to that success? Lieutenant Schaefer asked for this earlier, but I'm just going to ask you, if you have been adjacent to, inside the work of Northern Colorado over the last 7, 10 plus years, raise your hand. Raise your hand, please. Oh, I know there are more of you out there than that. But when Northern Colorado gets together, we may not be able to cause an earthquake like the Swifties did in the Pacific Northwest, but when we stomp in Northern Colorado, things happen. And about 10 years ago, we said to ourselves, if we are listening for hoofbeats, they're not coming. The cavalry is not coming to save us. And so we said, the solution exists here. And I and so many others who exist in this room, and many who couldn't make it today, opened up our offices and our hearts and our minds and came to the table and said, what is it that we can do? And we have been meeting quarterly at 7:30 a.m. on a Friday morning for probably the last 7 years, because that's how we get down up here in Northern Colorado. And we said to ourselves, what is it that we can do? Where are we needed? What can we do? And I think some of the pillars of our success here in Northern Colorado are partnering. No disrespect to any other part of the state, but we are badasses at partnering up here in Northern Colorado. We throw off all of our our protections about our patient population, et cetera, and we say we want to come together, and everyone is welcome at the table. And if there are folks that we feel like should be at the table who are not at the table, we're going to come and get you. We believe deeply that this is not a scarcity model of treatment delivery, of patient populations, and none of that is more true or spoken than, or better demonstrated. Chris, if you could put up our Care Compact. In 2019, we came together. There are 2 federally qualified health centers who signed this Care Compact, 2 federally qualified health centers, 2 community mental health centers, 2 opioid treatment programs, our residency program, and Front Range Clinic, who is now Porchlight Medicine. And there are so many partners: Banner, UC Health, Larimer County Jail, Weld County Jail, Larimer County Public Health, Larimer County Government, Weld County, who came together to make this work happen in northern Colorado. And we signed this Care Compact and said, 5 years ago, that we were going to abide by some really simple principles in terms of how we deliver care to our folks in our community who are suffering with substance use, and it was easy to get this signed. So that's the partnering, and this Care Compact are really testimony to the ways in which we've been successful here in northern Colorado. I would also offer that brain science of addiction is another tenet of our success here in northern Colorado. We decided 10 years ago that if we were going to offer and be a thought partner to and design good care for and good policy for, we needed to deeply understand this condition, and we weren't. We knew that as long as we allowed for messages like moral failing, pull yourself up by your bootstraps, you have to hit rock bottom, you have to have therapy in order to receive addiction treatment. If we were going to live inside all of those trappings, we were going to mismanage the solutions to the problem. As long as we misunderstood this condition, we were going to misunderstand and mismanage its solutions. So there's not a single one of us who was around in the early days who could not describe and teach and educate our colleagues around the brain science of addiction and really tell the truth about what this condition is and what it isn't. So I think that's another tenet of our success. Another is research and evaluation, and I think, Brooke, you mentioned that, and some others have mentioned that. We have been supported in our many grants by a research and evaluation arm that has made the description, the qualification, the analysis of our work incredibly robust, and the ability to put that out into our community and really talk about our success. So I think those are some of the ways in which we've been successful. One of the things that our research arm and evaluation arm did early on was to measure our connectedness. And I think those of us, on the outside were like, well, I don't know, what does that mean? And I wish I had brought the slide, because they mapped out all of our partnerships, and they did the survey twice a year apart. And our level of connectedness in northern Colorado initially was evaluated as strong and only got stronger over time. So I think those are some of the ingredients to our success.
Don, why have you done all the projects that you have done? What drove you?
I think you only have to see so many people die of an overdose or something that is absolutely preventable to be filled with a sense of both moral outrage and a desire to do something that's radically different than the system that has resulted in so many deaths. Right. I'll be brief.
Thank you. Leah?
Let's see. I really come from prevention. Substance use prevention is my kind of early stage. I've been doing that work for 20 plus years. And so that really came from working in direct youth services, which I know many of you out there do, and it's incredibly both rewarding and incredibly exhausting. And so I think that kind of got me my start in wanting to work in this space around substance use disorder and just working within communities where it's both messy and invigorating.
Myself. Why am I here? I had a niece that I used to get a phone call from. Terry, it's your favorite niece. I didn't have to ask who it was. I knew who it was. She started working on this project, delivering naloxone to the sheriff departments. I knew she was in recovery. I thought she'd bypassed all of that, as those of you that have been there know. Her back seat of her car was full of boxes, cases. Her trunk was full of cases. But you cannot deliver it to yourself. I don't know how strong to send that message. That's why I'm so passionate. Thankfully, we have a board in our Region 4 that is very passionate as I am. I don't know what I'd do without Scott Weaver as the chairman. He drives us. Alea keeps us on track. We got Dawn on board. Dr. Brooks, thank you for all you've done for us. It's a team, and we have to work as a team, as every region does. Can we cross regions? Absolutely. We shouldn't be remaking the wheel. Let's work together, as has been said across the panels all along to this morning. We can get this done. We don't need any more deaths. It affects so many families. It's just unbelievable. Dr. Brooks, I'll give you the closing moments.
I'm not sure how I feel about that. But in terms of the question is what drives us, right? I think for me, it is you can't work in healthcare without understanding that there are places where there are haves and have-nots, where we have under-resourced communities. But I think one of the things for me that was really jarring was to discover not just inequities, right, but that those inequities are writ largest at the intersection of substance use, mental health, poverty, and race. Nowhere is our ability to restrict care, to say yes to you but no to you, more apparent than in how we regulate substance use. And as I leaned into this work, one of the things that our Northern Colorado community asked, and that I really appreciate every day, is, why do we do it this way? Why do we do it this way? And who's harmed because we do it this way? And really considering what it means to sort of say, well, the regulation says this, and the regulation says this, but asking ourselves, why? Why? And is there anything that we can do about it? And I could not be more privileged to work in a community. We can't dismantle all the bricks, but we have certainly asked ourselves the question, why do we do it that way? And have dismantled some bricks one by one. So thank you.
Thank you so much to our panelists, and once more, a round of applause for them.